Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and today's Thursday, March 18, 2021. It's time for our weekly TRMC community update. I first want to thank everyone at Titus Regional and from our emergency disaster teams for yesterday. Wednesday, storms blew through, and they blew through quick. I was driving in when I've got the alarm on my phone, and we saw the winds pick up. Our security did see a funnel cloud above the hospital, and we did see an electric lightning bolt hit the hospital yesterday morning. Thank goodness and thank to good Lord above, nobody was injured and nobody was hurt. We lost a few doors, so the wind blew through. When you're driving through the parking lot or the interstate, you're going to see our signs. Our signs and billboards took a beating yesterday, and we'll work quickly to get those repaired. But as you can tell, we live in Northeast Texas, and my mom's watching. I can tell already. And tornadoes are a big deal in my family. We lost a house back in '84 through a tornado. But when you see that come through yesterday, and you know where we live, emergency management's a big part of the health system, a big part of what we do on a daily basis. So I want to thank Matt and Tim and the team that jumped into action yesterday, and everybody on the floors who quickly got our patients where they needed to be protected when the storms came through. So again, thank you to everyone involved yesterday and the chief and everybody from the county. Big time of the year, and the people who know me know I love sports. And with the March Madness today, I'm sure most of you are tuning in to find out who I picked in my bracket and who I did to there. So it is Gonzaga, and I have Baylor in the Final Four, and a lot of Big 12 teams doing well. Not a Big 12 fan. I'm an SEC fan, but I don't like losing. So I did try that this year. So we'll see how it goes. I'm probably going to come in last this year because we've been busy. We've been busy for the last 14 months. So to be honest, I haven't watched much basketball and really don't know what's going on for the first time in many years in the NCAA tournament. But maybe we can relax and enjoy some basketball over the next few days, next few weeks from Indianapolis. And so for the ones who enjoy it, good luck. I'm going to start today different. I'm going to start with vaccines. And want to thank everyone 65 years and older who came out last Friday. We had a few-day notice of some vaccines available from the state. They showed up at the Civic Center on Friday. And want to thank the state, the emergency management team who worked with us to get those. 350 people got vaccines, and that was great. So we were excited about that. The bad news was Saturday morning when I saw that we received no first dose allocation for the second week in a row. To say I'm frustrated with the allocation process is an understatement. And I used time this weekend to draft some letters and draft some emails and make some phone calls. And I appreciate Judge Lee's support and Chief McCrae's support. City Manager Mount Pleasant, the mayor, are working with us, and we're trying our best to get more vaccines to this area. But one thing I do know is I need your help. And I need your help from a standpoint of 65 years and older. And please pay attention tomorrow. Watch Facebook. We're going to put a new wait list up. We are calling everybody on our current wait list that's 65 years of age and older. These members of our community are prioritized by the state and the health system to get their vaccine now. And we're trying to reach out. We're reaching out to everybody on our wait list, but we also want to make sure. So if you have friends, family members, if your parents, if your brothers and sisters are 65 years and old, we need to make sure they're on the wait list and get them on again. We're calling everybody on the list today, but quite a few of these people have their vaccine already. So we want to make sure that every person in Titus County and the four surrounding counties, Camp, Morris, Franklin, Red River, 65 years and older, get the vaccine as soon as possible. So check our website at titusregional.com. Tomorrow we'll be launching, hopefully late tonight, but early tomorrow morning, we'll be launching a new wait list for 65 years and older. And at the minute I get that first dose and we have it, these people will be prioritized to get in that list. We're working closely with the state. If you look at the state's numbers, Titus County and Northeast Texas is behind the rest of the state in 65 and older. So we have a lot of people who aren't don't know what the old wait list was or where to go, where to call. So I would encourage you, get them on the wait list. We will also launch a phone number for 65 and older once we know when we'll have first dose. But again, at this time, I don't have any first dose. But we want to prepare. We're also working with the state to get another another shot at the Civic Center in the next few weeks as well for 65 years and older. But we need your help. So please make sure if you have your parents, your brothers, sisters, or yourself, let's make sure we get everybody vaccinated who's 65 years or older. So I talk about my frustration, and I love data. I'm good in Excel and do a lot of things. When the state's numbers came out Saturday morning, and you can look, we're in region 4-5 North, and that's the region we are. So when you look at the allocations and the vaccinations of one dose, of who's eligible, 65 and older who's eligible, and 16 years and older who's eligible, you can tell Northeast Texas is below the state average and below the rest of the regions. This is unacceptable. And I made that clear to the people on the phone on Monday. We are rattling as many cages as we can, try and ask for more on a weekly basis, and we hope that'll be listened to. When you look at Titus County as well, from our county's perspective, the 4 counties that surround Titus and Titus, you can see we're behind for I call it our primary service area, which is these 5 counties, because this is our community. This is where we live. You can see as at 5 counties, we are behind not only the region, but we are also behind the state as well. So we have a lot of work to do in Northeast Texas to try and get more vaccines here. And then once we get it here, do something with them and get everybody vaccinated. So I appreciate your support. I would encourage you to reach out to your state senators, your state representatives, and if you have a brother or sister who happens to be on some important council in Austin, wouldn't mind giving them a call and giving a shout out. But I will tell you from a Titus Regional Medical Center perspective, we're doing as much as we can to try and get those vaccines here. We would appreciate your help. So we're going to talk numbers. We got to talk COVID as well. Vaccine's critical, and that's how we're going to get to the next step. The COVID numbers, I was in a meeting a few minutes ago, and it was great to hear over the loudspeaker, COVID-19, 3rd floor to ER, COVID-19, 3rd floor to ER. That meant a patient was leaving from our COVID floor. That we only had one patient on the floor. So for the first time in several weeks, we're back down from one patient to no patients in the hospital of COVID. That's a great sign. We hit that about 2 weeks ago for about 4 hours, and then we had some patients who were admitted. But right now we were able to discharge our last COVID patient, so it's a great sign. And from a regional perspective, you can see the region continues to go down with only 24 to 25 patients this week in the hospitals with COVID and about 12 patients with in ICU. And then from a Tyler perspective, you can see their numbers coming down as well, with down to 97 patients with COVID in the Tyler area and only 33 ICU beds as of yesterday and last night. So as you can see from that perspective, the numbers are coming down, and we're excited to see that. The one thing I will call your attention to that worries me a little bit is the beds available. When you see those ICU beds available, the state did put out a mandate and is going to start pulling back strike team members, so members that have been given by FEMA and to the state to use in hospitals to fill in gaps. They're starting to pull those back immediately. There was a plan to slowly pull back the number of staff members who are across the state, but they're going to expedite that and pull those back quicker. And it concerns me because that means we're going to have less ICU beds available. It means we're going to have a shortage of nursing staff, respiratory therapy, EMS, and the med-surg ER staff as well. So I am concerned when we start hearing that and I see the numbers, they're going down. I'm excited. So the one thing I can make sure we do in that situation is encourage you to wear your mask. We have to continue to vaccinate. We have to continue to wear our mask. And I don't want to make the weekly updates about COVID, but we're at a point right now as spring is starting to come into place and moving forward that we have to do everything we can to mitigate the spread and slow the growth. So I would encourage you. I am wearing my mask wherever I go. My family is wearing their mask, and I would encourage you to continue to wear your mask. In the health system, it's required, and I want to applaud many of our businesses in town who are still requiring masks to be worn. It protects their staff members, but it also protects you. Flu is down this season, and it's not because it's a made-up number. No, flu is down because we're washing our hands, we're wearing our mask, we're social distancing, and those are some good things. I know it's tough, but I implore of you and just all out beg of you to continue to wear your mask, continue to show respect to everybody else. Wear it because you care. Wear it to do that right thing. And I know it's difficult and it's frustrating, but I would encourage you, and I want to thank you for wearing your mask. You are making a difference. And as we go into the weekend, I'm excited about this weekend. And, the spring was in the air, and then that cold air came in last night and kind of didn't like it today. So hopefully as the sun comes out this weekend and we're able to get outside more and do some things and kind of start enjoying the decline in COVID. I wish you the best this weekend. I want to thank you for your support of our health system, and thank you support of me and everything we're doing here at Titus Regional Medical Center. God bless.